the problems he's had, and he's published one on the politics of fluoride along with the side effects, and it's the struggle with titans, which was a result of his failing to influence authorities. As president of the American Allergy Association, he had a lot of credibility, but his work wasn't taken seriously in terms of the establishment not taking it seriously, but it was certainly looked at very seriously by the doctors who were following up on the safety of fluoride. And as such, he's one of the many, many researchers who've done solid work, clinical work, showing that the hundreds of case histories of people becoming ill after exposure to fluoridated water.
And then he's been dismissed, would you say?
Never scientifically. His work is still valid, but it's the absence of a biochemical test which will show up whether or not the fluoride is interfering with metabolism. That's the sort of hurdle which hasn't yet been jumped in medicine. With allergy to peanuts, you can do an immune assay to show antibodies to the peanut protein. That's what you call a positive pathological test to show you mustn't have them. But with fluoride, it's a poisoning. In much the same way as lead, there's no antibody response to the lead or the fluoride. So you can't do a simple allergy test to confirm it. With lead, you can do a test to see how much there is in the body. In fluoride, to see how much fluoride, you have to extract a piece of bone to assess it. And that's a very difficult test that most people are unwilling to have done. So this is where blood levels, urine levels do not show that sensitivity reaction, so it remains a bit off the screen. And so this is where a test has to be developed which can assess the change in metabolic health of the person who is claiming to be getting adverse reactions after fluoride exposure.
What about hair samples, just briefly? Do you think hair samples are useful as a tool?
Yeah, hair samples do show up when people are taking or have got excessive fluoride. You can do an assessment through hair samples, but it has to be done it's not normally done with a normal hair analysis. You have to get the laboratories who can specially process the hair to get the fluoride levels assessed. But when that is done, practitioners who are carrying that out are finding a connection with the elevated fluoride levels in the hair and health problems.
In 2006, the US National Research Council said that more research needs to be conducted on fluoride hypersensitive reactions in general and subpopulations. Australian authorities have dismissed this report as irrelevant to this country. Is there adequate research into fluoride hypersensitivity in the Australian population?
No, not by authorities. The American report, which recommended the testing be done, was just reflecting the identical request from the National Health and Medical Research Council in 1991 that said that testing into sensitivity to fluoride must be carried out. And as a result, the NH and MRC now appear to be going against the earlier recommendation without that testing ever having been done. And from the clinical evidence, it appears that that was a rather bad oversight on their part. So the American research in 2006 is now recommending that that be done again, and this is where, of course, it would result in an explanation as to why people are getting sick from the fluoride exposure on a scientific level.
New Zealand scientist Bruce Spittle recently published a book titled Fluoride Fatigue. Can you elaborate on the importance of Spittle's work?
It is very important, as Dr. Spittle has condensed the medical literature that reported on side effects from many doctors, dentists and scientists doing government work and their own clinical observations, and he's listed around about 24 different common symptoms of fluoride toxicity. And that's really important because most doctors and dentists are informed it's completely safe. And this is difficult to focus on just, is fluoride causing the skin rash? Is fluoride causing the abdominal pain? Is it causing the muscle fatigue? Because I can go on for 20 or so different common symptoms, and this is where they normally get treated with anti-inflammatories, cortisone for the skin rash, but doctors and dentists are not generally aware of what side effects to look for. So Dr. Bruce Spittle, in reviewing the medical literature and condensing into a small medical handbook the major symptoms, that is extraordinarily important for health practitioners, everybody in the health field, to be looking at his work, because that, as I've found with dentists who are finding fluoride reactions and puzzled by them, once they see the work, they immediately recognise that the work's been done before, showing that these are the symptoms I wasn't told about at dental college, but now the medical research is showing I should have been, because my patients were getting sick. So it's very critical for health practitioners to become aware of this, because I see 2 or 3 patients a week who are possibly getting side effects from fluoride, from the water, toothpaste, and I find that the treatments given are often quite effective. Cortisone treatment for the skin rash, but the cortisone, once it's ceased, the complaint comes back, and that's when clients will come in to see me, and I'll say, well, try getting off the fluoridated water and see what happens, and often that's what's needed. And as a result, this is where Dr. Spittle's work is critical for health practitioners who are dealing with the public who may be getting affected by fluoride, to become clinically aware of what they should be looking for. And Dr. Spittle's work also shows the testing procedures of how to avoid the exposure to the fluoride, and then watch to see a change in symptoms. So clinically it's very, very relevant.
Okay. Do you think health professionals Australia-wide, even though they may have perhaps been indoctrinated that it's safe, that fluoride is safe and effective, do you think it would be wise for them to review their stance and look at the latest research, especially work that's coming through from overseas scientists and professionals? There's a lot of work on Dr. Paul Connett's website, which he pretty much unites or yokes together all the current research that's been done on the various organs. Do you think health professionals should be revising their stance?
Health professionals should be revising their stance on fluoride, first and foremost from the point of view of the patient, so they do not miss effective diagnosis of their conditions, and treatment becomes just ineffective unless the causative factors are basically assessed. And that's where the big problems come in, where I went through naturopathic training and I didn't receive any introduction to the medical literature with reports on the side effects. I assumed dentists, naturopaths, possibly chiropractors, maybe getting that same official line that there is no symptoms to be concerned about. When you get into practice and you see people are getting sick, and you then avoid the fluoride, get them to avoid the fluoride, and they get better, then you realise it shouldn't be something that you have to find out in clinical practice. It should be incorporated into the educational program to avoid those problems.